Respected audience, Assalamu alaikum. I am Professor Shamsid Jaman, Professor of Pathology. I welcome all in today's 25th lecture on pathology. Today, day 2 of tissue renewal. It is day 2 of healing and repair. Today's topic granulation tissue, complications of wound healing, and factors influencing wound healing. Dear audience, today's topic granulation tissue, complications of wound healing, and factors influencing wound healing. Respected audience, in day 1 lecture on tissue renewal, I have told you about cutaneous wound healing and healing of fracture of bone. And I have told you the wound is healed by granulation tissue. Now come to what is granulation tissue. Newly formed mesenchymal tissue composed of proliferating fibroblast, newly formed capillaries, ground substance, and a few chronic inflammatory cells like lymphocytes. So, granulation tissue is newly formed mesenchymal tissue composed of proliferating fibroblasts, newly formed capillaries, ground substance, a few chronic inflammatory cells like lymphocyte is called granulation tissue. Students, I have told you, if this is a wound, cutaneous wound, and this is the margin of wound, and this is the subdermal tissue, fibroblast proliferated here, and this fibroblast synthesize the collagen fibers. And from the existing blood vessels, there is formation of new capillaries, new blood vessels, and this is called neovascularization. And from mesenchymal tissue, there is synthesis of ground substances, and there is infiltration of some lymphocytes, that are T lymphocytes. Although these are chronic inflammatory cells, these cells helps in synthesis of collagen, helps in proliferation of blood vessels by producing lymphokines. Now come to what is the role of granulation tissue. This tissue helps in healing and repair. Now come to what is the criteria or characteristics of granulation tissue. Characteristics of granulation tissue, I mean how a surgeon can recognize the granulation tissue. How a surgeon can recognize granulation tissue. Pink in color. It is pink color, soft and velvety. It is granular and it bleeds to touch. So these are the characteristics of granulation tissue, and by these characteristics surgeon can recognize granulation tissue. The color is pink, soft and velvety consistency, granular appearance and bleed to touch. Why granulation tissue bleeds to touch? Why it bleeds to touch? Because there is neovascularization and the new capillaries is with no complete vessel wall, is with no complete basement membrane. Due to incomplete vessel wall or incomplete basement membrane of the newly formed capillaries, it bleeds to touch due to incomplete vascular wall of newly formed capillaries. It bleeds to touch. Now come to complications of wound healing. Non-union, there may be no healing or no union among the two wound margins. There are so many causes of non-union. It may be due to presence of foreign bodies, it may be due to malignancy, malunion. There is healing but malpositions of the margins. Infection, dear audience, we know reaction of vascularized living tissue to local injurious agent is called inflammation. If inflammation is caused by microorganism, then that inflammation is called infection. Exuberant granulation tissue formation. What it means? It means excessive granulation tissue formation. It means excessive granulation tissue formation, and it is also called proud flesh. So exuberant granulation tissue means excessive granulation tissue formation. It is also called proud flesh. If excessive granulation tissue is formed in the wound, why it is complication? this excessive granulation tissue may lead to hypertrophic scar. It may lead to also painful scar. Burst of wound. It is also called wound dehiscence. Wound dehiscence. What are the causes of wound dehiscence? One is, if laparotomy is done, this wound may burst due to increased or raised intra-abdominal pressure. So raised intra-abdominal pressure following laparotomy. If there is raised intra-abdominal pressure, there is chance of wound dehiscence. Another is infection of the wound. Another is inadequate granulation tissue formation. Inadequate granulation tissue formation. Respected audience, I have told you granulation tissue helps in healing. If there is inadequate granulation tissue formation, there may be chance of wound dehiscence. Weak scar formation, hypertrophic scar formation, keloid, epidermal inclusion cyst. So these are the different types of complications of wound healing. I have told you here hypertrophic scar. What is it? It is a raised scar within the wound margin. A raised scar within the wound margin is called hypertrophic scar. Dear audience, if this is the wound and this is the skin, if the scar is raised here after healing and raised scar and it is within the wound margin, then it is called hypertrophic scar. I have told you here keloid. Now come to what is keloid. Raised tumor-like mass due to excessive collagen beyond the wound margin is called keloid. So it is raised tumor-like mass, and the mass is beyond the wound margin, not within the wound margin like hypertrophic scar. Rather, it is beyond the wound margin, and it is due to excessive collagen. So if this is the wound, like this wound, skin, if due to excessive granulation tissue, this is the raised tumor-like mass, and the mass not within the own margin, rather it is beyond the own margin. This is called keloid. Keloid, it is a complication. It is a complication of wound healing. It is genetically predisposed. It is genetically predisposed. As it is genetically predisposed, after excision, it can recur. It recurs following excision. Why it recurs? Because it is genetically predisposed. Now come to common sites of keloid formation. One is sternum, another is face and ear lobe. These are the common sites of keloid. So this is all about the complications of wound healing. Now come to factors influencing wound healing. Dear audience, there are some factors that may enhance wound healing, and there are some factors that may delay wound healing. And the factors is divided into two. One is local factor, another is systemic factors. One is local factors and systemic factors. First come to local factors. Size of wound, site of wound, infection, mechanical factors, foreign body in wound. These are the local factors that may influence wound healing. First come to size of wound. A smaller size, of wound, faster healing, and larger size of wound delays healing. So if the size of wound is smaller, it will be healed earlier. It will be healed faster. Site of wound. Wound in face, wound in face heals faster than wound in leg. Why? Why wound in face heals faster than wound in leg? Because of high vascularity in upper part than the lower part. Because of high vascularity in face than in leg. Then infection. Infection in wound delays healing. Wound delays healing. Then mechanical factors. Motion in wound. Motion in wound delays healing. Why motion in wound delays healing? Because if motion in the wound, there will be compression of the blood vessels and there will be separation of the wound margin. So it will delays healing. Why motion in wound delays? Because motion causes compression of vessels in wound. Again, motion causes separation of wound margin. Separation of wound margins. So motion causes compression of vessels in the wound. Motion causes separation of wound margins. So there is dealing of wound healing. Foreign bodies. Foreign bodies in wound like suture material, like any bone piece. These may cause delays healing. So these are the local factors that may influence wound healing. Now come to systemic factors. Age, anemia, nutrition, vitamin deficiencies, metabolic disease, hormones. So age, nutrition, anemia, vitamin deficiency, metabolic disease, hormones, these may influence wound healing. First come to age. Wound in early age faster healing than wound in old age. Wound in early age faster healing than in old age. Why? Why there is delaying of wound healing in older age? In older age, there is atherosclerosis. Respected audience, you know, in atherosclerosis there is hardening and loss of elasticity of the vascular wall, and atherosclerosis usually occurs in old age, as there is loss of elasticity, diminished blood flow in tissue. As diminished blood flow, so there will be delayed wound healing. Now come to anemia. Respected audience, we know reduction of hemoglobin per unit volume of blood below the normal level as per age and sex is called anemia. In anemia, there is reduction of hemoglobin. Reduction of hemoglobin in blood, and you know hemoglobin carries oxygen in tissue, so decreased carrying of oxygen in tissue. As decreased carrying of oxygen in tissue, there will be delayed healing. Now come to nutrition. Nutrition is associated with wound healing. If there is deficiency in nutrition, wound healing will be delayed. Now come to vitamin deficiencies. Vitamin C is associated with synthesis of collagen by fibroblast. If there is deficiency of vitamin C, decreased collagen synthesis by fibroblast. As collagen is one of the component of granulation tissue, so there will be decreased granulation tissue. As decreased granulation tissue, wound healing will be delayed wound healing. So vitamin deficiency delays wound healing. Now come to vitamin A. Vitamin A deficiency delays wound healing. How? Dear audience, you know vitamin A is associated with normal epithelialization. As there is vitamin A deficiency, there will be inadequate epithelialization. As inadequate epithelialization, there will be delayed wound healing. Now come to metabolic disease. Metabolic disease like diabetes mellitus, If anybody suffers from diabetes mellitus, there will be delaying of wound healing. Delays wound healing. Why delays wound healing in diabetes mellitus? In diabetes mellitus, there is immunosuppression, and in diabetes mellitus, there is every chance of infection. So there is delays wound healing. Now come to hormone. Hormone, corticosteroid. Application of corticosteroid delays wound healing. How corticosteroid delays wound healing? Dear audience, if this is wound, you know, in 24 hours there is inflammation, and inflammation is mandatory for wound healing. Inflammation is important step in wound healing. If anybody applies corticosteroid, it acts as anti-inflammatory agent. Due to anti-inflammatory action of corticosteroid, there will be delaying of wound healing. How anti-inflammatory actions of corticosteroid is carried out? Corticosteroid inhibits cyclooxygenase pathway of arachidonic acid metabolism. Dear audience, you know, arachidonic acid is metabolized by two pathways. One is cyclooxygenase pathway, another is lipooxygenase pathway. What happens with the pathway? There is production of chemical mediators of inflammation. If anybody applies corticosteroid, inhibits the cyclooxygenase pathway of arachidonic acid metabolism, so there will be no production of chemical mediators, and there will be no inflammation. So no inflammation. As inflammation is one of the steps of wound healing, and as there is no inflammation due to application of corticosteroid, so there will be delaying of wound healing. So delayed wound healing. So this is all about the systemic factors that influences wound healing. Dear audience, today I have told you about granulation tissue. It is newly formed mesenchymal tissue composed of proliferating fibroblasts, newly formed capillaries, ground substance, and few chronic inflammatory cells like lymphocyte. It helps in wound healing. It is velvety and soft, granular, pink color, and ability to touch. I have told you about the complications of wound healing: malunion, non-union, infection, wound dehiscence, proud flesh, painful scar, weak scar, hypertrophic scar, keloid. Lastly, I have told you factors influencing wound healing. There are two factors: local factors and systemic factors. Today up to this, thanks all.